Hey there, Jennifer here. Today we are cracking the code on treatment for fluent aphasia. So, you may remember that the two most common types of aphasia are Broca's aphasia and Wernicke's aphasia. If you haven't learned this, click the link above. Treatment for aphasia is going to depend on the type of aphasia the person has. Today, I'll be talking about treatment for fluent aphasia, also known as Wernicke's aphasia. Treatment for this aphasia type will focus on what's called auditory comprehension, which is improving how the brain interprets what it hears. As you may remember, treatment for auditory comprehension is going to require your loved one much more mental effort, which means that it's going to be a lot easier for them to become frustrated or depressed as they work through these processes. So be patient with them. As speech therapists, our goal in the treatment of aphasia is to increase communication. The patient sitting next to us wants to recover enough language to get on with their life. They're not striving for perfection. So as caregivers, remember this when helping them through their stroke recovery. My favorite quick and easy resource for aphasia treatment is the WALC, W-A-L-C, Aphasia Rehab Workbook. I'll attach a link below in the description section if you are interested. Otherwise, you can just search Google and see what you can find. So let's begin at the top. If your loved one has severe fluent aphasia, meaning they are not able to understand what you are saying to them, and they likely aren't understanding what they are even saying out loud, then you want to have them start by working on understanding single words. You can do this by having them point to objects in the room as you name them, and then increase the difficulty by showing them pictures of items they less frequently encounter, such as maybe a picture of a paintbrush or a vase. After single words, you can progress to comprehension of phrases and sentences. For this, start with having them answer yes and no questions. Again, starting with easy questions such as, do you live in America? Or can you wear a tie? Then increasing the difficulty to, are all children the same size? Or is your neck above your chin? The harder or more complex the question is, the more your loved ones will have to rely on the relationship between the words and draw on their general knowledge of information. So from there, then comes the slightly more difficult closed-end questions that require them to provide a response other than yes or no. These might include, what utensil do you use to eat soup? Or how many items are in a dozen? Again, you can make these questions easy or hard depending on your loved one's ability, but these type of questions need to have a defined answer, not a question that is left up to interpretation, because those are known as open-ended questions, and they are the next step in working to improve comprehension. These questions allow for more flexibility in the structure of questions and in the variety of answers. What does that mean? Well, it means that if you're helping your loved one using open-ended questions, you may be able to restructure the question to increase their ability to understand it. For example, if you ask the question, how did it go at the doctor today? And your loved one isn't able to respond or answer you, you can try, tell me what the doctor said. Other examples of open-ended questions are, what kind of music do you like? Or, what do you want to do today? These questions will require more thought and more than one word to answer appropriately. Another way to target comprehension is by following spoken directions. I usually do this using 2 to 3 to 4 objects, depending on the patient's severity. This task is targeted in a hierarchy approach, from easy to hard. When you are targeting a person's ability to follow directions after a stroke, it is best to follow this hierarchy since it will decrease frustration and allow for success. Again, remember that when you are helping your loved one, if the task becomes too difficult, then they're going to want to quit and give up. Think about it like a new workout routine. If you start by trying to lift 20-pound weights or run 1 mile after being a couch potato for years, you will likely fail. hate working out, and there will usually be no next time. So the same goes when your loved one is having to relearn how to understand language again. You must start easy, allow them to succeed, and then introduce more difficult type concepts. Okay, so here is the hierarchy for understanding directions. Again, I use between 2 and 4 objects at a time. Hang in there, there's 13 of these. I will show you how each one works and post a link in the description section for you to have at home. Alright, so here are the 4 objects that I will be using today. The sequence goes like this of the hierarchy approach. First one, number 1. Point to one common object by name. Point to the cup. Number 2. Point to one common object by function. Point to one we write with. Number 3. Point in sequence to 2 common objects by function. Point to write with, then drink from. Number 4. Point in sequence to 2 common objects by name. Point to brush, then glasses. Number 5. Point to one object spelled. Point to P-E-N. Number 6. Point to one object described using 3 descriptors. Point to small, white bristles. Number 7. Follow one verb instructions. Pick up the pen. Number 8. Point in sequence to 3 common objects by name. Point to pen, cup, brush. Number 9. Point in sequence to 3 common objects by function. Point to write with, see with, drink from. Number 10. Carry out 2 object location instructions. Put the pen in front of cup. Number 11. Carry out in sequence 2 verb instructions. Point to glasses, then turn over cup. Number 12. Carry out in sequence 2 verb instructions with time constraint. Before you pick up the pen, hand me the cup. And number 13. Carry out in sequence 3 verb instructions. Point to the brush, turn over the cup, hand me the pen. There you go. All right, so keep in mind that this activity is designed to target verbal retention span and comprehension of information. So if your loved one has dementia or any other type of cognitive decline, then even though they may be able to understand, they may not be able to remember what you asked. So you have to take that into consideration. After directions, you can start working with your loved one on understanding the meaning of sentences using picture scenes. This can be done using magazines or picture books, using about 2 to 4 pictures at a time. Simply say a sentence, then have your loved one show you the picture that is correct. Okay, so after your loved one has mastered understanding phrases and sentences, you can then move on to conversational speech activities. And this is the highest level. To work on understanding conversations, you can read an article from the newspaper or from a magazine, and then ask different questions to see how much they were able to remember and understand. The most complex task would be to have them retell the story in their own words. So, there you have it, caregivers. You are now equipped to help your loved one work on understanding language after suffering a stroke. I hope you found this information useful, and I encourage you to try some of these activities at home. And when you do, please leave a comment and let me know how it went, and any difficulties you may have encountered. In my next video, I will go over treatment for non-fluent aphasia, so check back again in a couple of weeks. Thanks for watching, and until next time, good luck cracking the code.